Welcome to Your Senior Advantage. We have a very special segment today. We've done 30 minutes of recording time on Medicare, and we're trying to answer as many questions as we could about Medicare. Welcome to Your Senior Advantage. I'm sitting here with Dan Young of Young's Insurance Services here in Montgomery County. Dan specializes in Medicare, which is the open enrollment period started, I think, on the 7th of October, so we're right in the middle of that. And he's going to talk today about Medicare and open enrollment plus the Affordable Care Act, because everybody kind of has a little bit of confusion when it comes to that. Dan has over 15 years of experience in Medicare insurance, and his company has consistently been in the top of the companies that sell insurance in Montgomery County. So welcome, Dan. We're glad to have you.
Thank you.
Listen, Dan, we had some questions that we actually, actual people sent into YSAT. And if that's all right with you, I'd like to ask those questions of you.
Absolutely.
Because those are the people who give us what we need to know. And Mike from Collegeville actually asked, I have Medicare now, and I've heard about the exchanges and subsidies for people with lower incomes. How can I apply for that?
Well, if Mike's on Medicare, Jackie, he really should not be applying for the exchange or any subsidies. Medicare beneficiaries do not qualify for subsidy at all, even if they are low income, because there are other programs that are available to them. And as far as joining the Affordable Care Act exchange programs, there's really no benefit for a Medicare beneficiary to do so. They get equal or better coverage under Medicare itself right now.
So what is the Affordable Care Act exactly? Is that what they call Obamacare? Is that?
Yes, that's the other word for it. Obamacare and the Affordable Care Act are the same thing. There was a news program a couple weeks ago that had done a, are you in favor of Obamacare or Affordable Care Act? And in fact, they're the same exact thing. We don't have enough time for me to tell you exactly what the Affordable Care Act is in general, other than to tell you that people are now given the ability to purchase insurance with no medical questions and no pre-existing conditions being required upon them. There are subsidies for lower income individuals and families, so there is some help out there for people. But again, as far as Mike is concerned and the Medicare beneficiaries, they should not be enrolling in any exchanges.
In this open enrollment period, do they have to answer questions when they're taking on Medicare?
That's a great question. We get that quite a bit. With the Affordable Care Act, it does not affect Medicare supplements. So people that are on Medicare currently and want to change supplements, they may have to go through medical questionnaires and underwriting. If they're in a Medicare Advantage plan or want to join a Medicare Advantage plan, then there would be very little medical questions asked. And for prescription plans, if someone's joining a new prescription plan, no medical questions, no pre-existing conditions. But again, that had nothing to do with the Affordable Care Act.
Okay, all right. So if someone asks you for your information, because believe it or not, you get asked for your Social Security number all the time.
Right.
Should you give your Social Security number when you're applying for these things, or do you need to do that?
When you're applying for something, yes, but no one should be just cold calling you out of the blue, and then you're all of a sudden being enrolled into something. Never give your phone number or your Social Security number or your Medicare ID number out over the phone to someone you have no business relationship with whatsoever. With the Affordable Care Act, there will be a lot of scams that are going on, authorities fear, that people will be saying, hey, we can enroll you into this plan for Affordable Care Act. You don't want a penalty, or you do qualify for subsidy. So give us your information and we'll get everything done for you. No one is doing any enrollments like that, so that would be completely a scam. Immediately hang up the phone and contact your local authorities.
And you should really sit down with somebody and do this either in their office or your home.
Correct.
And then you're safe to give your
Exactly.
Social Security.
If you're enrolling in it, they should have the proper documentation. Myself, I carry around a state license to show that I am actually who I say I am.
Mm-hmm. Oh, that's great. Okay. So how will this Affordable Care Act affect Medicare? Is it going to affect us at all?
Well, it'll have effects on Medicare without a doubt. Some positives to it: it's going to close the donut hole, which is the gap in prescription coverage. of Part D of Medicare. So by 2020, that will be gone altogether. Okay. Also, the negatives, though, however, would be that reimbursements to doctors are going to be cut. So there's a chance that some doctors may pull out of Medicare that were previously with it. Also, as far as the subsidized plans, the Medicare Advantage plans are subsidized by Medicare. To pay for the President Obama's healthcare reform, part of that subsidization is getting reduced by 30%.
Wow.
So we could see Medicare Advantage plans really raise in premiums or cut benefits in future years. Nothing major for 2014, though.
Okay, so Medicare you don't really pay for, that's given to you by the government, okay?
Well-
Or you do, but the supplement you pay for, is that how this works?
No, Medicare Part A, you've actually paid for in your taxes, or your
Okay.
spouse has, all your working years. Medicare Part B is a premium associated with it. Right now, that is $104.90 per month. That is income level related, however. So if you make above a certain amount, that amount will be higher. If you make below a certain amount, that amount could be lowered.
Oh, okay.
And then, of course, you have your supplemental or your Medicare Advantage plan premium to go on top of that.
Okay. Betty from Norristown asked us, do you have to join Medicare Part B if you're still working?
Well, that's kind of a tricky situation, and it would differ. My question to Betty would be, if Betty works for an employer with less than 20 employees, then she must join Part B of Medicare. If she works for an employer with more than 20 employees, she does not have to, and she probably should not join Medicare Part B because her benefits are probably better than what Medicare would offer, or at least less expensive than what Medicare would offer to her.
Oh, okay. How about if you have COBRA? What is COBRA, by the way?
COBRA is basically an extension of your health insurance benefits that you currently had while you were working. So, for example, if I quit my job for some point or I got laid off from my job, I could continue my benefits up to 18 months under COBRA, but I would be footing the entire bill that my company was paying.
Right.
So my share and their share. So it's a continuation of benefits. I don't have to go apply for benefits somewhere else or worry about that type of thing. I think it's just going to be a temporary until I find a new position. COBRA can be a little more expensive depending on the level of coverage that is out there. But if you also wanted to join an exchange with the Affordable Care Act, that would give you a special enrollment period to be able to do so.
Oh, that's interesting. Now, that's something new. Okay, Marge from East Norton says, I joined a Medicare Advantage plan last year, and I don't like it. So what do I have to do? Is there an open enrollment program where I can change this? And what can I do during that period?
Right, and as you said, the open enrollment period begins October 7th, runs through December 15th of each year. During that time, Marge could join another Medicare Advantage plan if she wanted to, or go back to original Medicare. I would really encourage Marge to explore all the options that are out there, because sometimes we get fooled by the fancy marketing materials that come in, or our cousin Sally had it, and it worked great for Sally while she had her operation, but our doctors don't participate with that. So you really want to make sure that Marge is exploring all options that are there, or anybody going through this.
So you really should be asking your doctor, do they actually subscribe to Medicare?
Well, you can check with your doctor. Under original Medicare, if you have original Medicare and a supplement, you can actually go to any doctor you want to go to in the country, even if the doctor doesn't accept Medicare. If that happens, however, then we have to fill out a claims form, and that's very rare that we run into that situation,
Okay.
but it can happen.
Oh.
If someone joins a Medicare Advantage plan, they should check with their doctor or check with the plan to see if their doctor is in the plan.
Okay, okay. How do you know if it's the right plan for you? Because that's a tough thing to do. I know when I was trying to figure it out, it was really hard. So
Right.
what is the right plan, and how do you know?
Well, there is no right plan. There's no bad choices, or no bad plans. There's bad choices. So people don't decide whether they should go into it just because, again, Aunt Sally had it, as opposed to what works for them. So one of the good ways to go is to call Medicare itself at 1-800-MEDICARE. They could call their Department of Aging. They could go to a professional like myself that represents all different carriers, so we can compare benefits and plans side by side to see what fits best for them.
Yeah, I think that's a great idea, sitting down and looking at all those plans. It's a huge task, but once you sit and start to figure out what your needs are, I think it really helps.
Right. One of the other things I should mention about that is if someone's doing something online through the internet and they're looking for plans, make sure they're looking at something that is from Medicare itself, not
Carrier.
another carrier or a lead company. Too many times I tell, or people tell me they were looking online for an internet, they try to get a quote from something, they hit the enter button, and all of a sudden the phone rings.
Yeah.
Because they've given all that information in there, and all that company does is selling it to many, many different brokers and things like that.
I have to tell you, I did that.
Did you?
Only they didn't call me. I realized as I was filling it out that it was a company. It
Right.
wasn't Medicare.
Right.
And so I stopped doing that. But I couldn't find Medicare again. It was really tough.
Right.
Because they really put all those carriers in front of Medicare so that
Right.
so you really do have to be careful.
Medicare.gov is the place
Yeah.
to go.
Yep, you're right. Let's see. They can call you, right, Dan, if they want to.
Absolutely, we're available. We
Compare?
have 10 agents that work in the area. We're in a couple local retail pharmacies where if someone wants to come up to us and talk to us. Again, we've been around for quite a while. We represent all the major carriers. We would be glad to help anyone out.
So you can really sit down with you and do all that comparison like we
It's
did.
a one-on-one comparison, just like you and I are talking right
Yeah.
now. There's no charge for it. Your prices are no different than if you went to the company directly. And you should always sit down with somebody professional and have someone you feel comfortable with. So if you have a brother or a daughter or a son that helps you make decisions like that, make sure they're there. And if the person that is sitting across from you doesn't feel comfortable with that, you need a new person.
Oh, I agree, absolutely. Connie from Plymouth Meeting says, I have been approached by someone saying they could sell me the exact same Medicare Supplement Plan C for less than I'm paying now. Is this possible?
Absolutely, it's possible. We have it happen every day. The coverages are exactly the same. So as Connie said, she has a Plan C. Well, Plan C through one company is a Plan C through another company. They're exactly the same benefits. So she should have no fear of making a change with that. But she wants to make sure it's a reputable company, someone that hasn't just come into the market and has low rates right now and wants to tease them and get as many people as possible, and then looks to have a bigger increases in the future. Connie also may face underwriting, so that might be a problem that she may have depending on her health. She may or may not qualify to be able to join the plan, which is sort of like what we were saying earlier. Would the Affordable Care Act affect Medicare recipients in that way? Unfortunately, Medicare recipients will still have to go through underwriting if they want to change Medicare supplements.
How long are those rates good for, Dan? Are they good for a year, or
It depends on the company.
Can they raise the rate, or?
It's completely dependent upon the company, Jackie. Most companies will give you at least 1 year guarantee. Some companies are instant. So if you join today and they get an increase tomorrow, you'll get it on Wednesday.
Wow, okay.
It's just one of those types of things. It depends on the carrier. So that's a great question to ask the company or the representative.
And how many carriers actually do supplemental insurance for Medicare?
There's over 50 carriers in
50.
Pennsylvania alone.
Wow.
There's 36 different drug plans that are available. So the choices are quite extensive. Medicare Advantage plans are governed by what county you live in. Medicare supplements and prescription plans are governed by what state you live in.
Oh, okay.
Okay. So
That's
all
the way-
36 drug plans are available throughout the state. But too often we have a client that lives out maybe in Lancaster talking to a client that lives here in Montgomery County, and they want the same exact plans, Medicare Advantage plans, and it just
You
doesn't
can't have
work.
it.
It doesn't affect it. Right?
Oh, okay. All right. So, when does the Affordable Care Act, it's in effect as well now? October 1st,
Affordable Care Act
was it,
started
or-
as of October 1st.
Yeah.
That's when people could join on to go to healthcare.gov, and they could find out if they qualify for any subsidy to join a plan. Benefits will not go into place until January 1st, however. So a lot of our clients have called us saying, I haven't been able to get insurance. The healthcare plan is now available. I want to start for November 1. Unfortunately, again, the benefits will not
Can't
start
do
till
that.
January 1.